Hello, and thank you for joining the Family First Prevention Service Act training. This training is being brought to you by the FFPSA Regional Prevention Consultants for the University of Tennessee Social Work Office of Research and Public Service, or SWORPS for short. FFPSA is a federal law that was passed in 2018. This is a major reform to child welfare systems, shifting the focus to maintain children safely in their homes whenever possible. This allows states to draw down Title IV-E federal dollars for prevention, which has not previously been possible. FFPSA provides the legislative and funding pathways for the transformation of the child welfare systems. The main focus of FFPSA is to maximize prevention efforts so that children are able to stay with their families. The key aspects are prioritizing prevention, reducing reliance on congregate care, supporting kinship care, and addressing racial and ethnic disparities. When we prioritize prevention, more resources are available for programs that address risk factors before child maltreatment occurs. A few examples of these are mental health and substance abuse treatment for parents, parenting skills training, in-home family support services, early childhood education, and child care assistance, just to name a few. States have the option to use Title IV-E federal funds for evidence-based programs for children at imminent risk of being removed from their homes. We also want to help the families maximize those formal and informal supports within their own communities. As we all know, it takes a village. Reducing reliance on congregate care helps address the family's holistic needs beyond just child safety concerns and define services such as skill-based parenting programs, individual and family counseling, parenting skills and parent education, substance abuse treatment and prevention, mental health treatment, and kinship navigation. Sometimes a child is unable to stay in the home due to safety concerns. When this happens, we support kinship care. Kinship care is when a family member steps up and acts as primary caregiver for the child or children while the family works on their issues. This helps reduce the trauma of being removed from their home and putting into foster care for the children. Through addressing racial and ethnic disparities, we see a continuously improve the child welfare system based on best practices and evidence. Overall, the FFPSA represents a significant shift towards a more preventative approach in welfare. However, its effectiveness will depend on ongoing implementation, evaluation, and collaboration among child welfare agencies, families, communities, and the public. There are 12 FFPSA regional prevention consultants across the state of Tennessee, one for each of the current DCS regions. The consultants assist the DCS frontline service professionals and the team leaders in helping them create quality, fast assessments, recommend community-based and EBP services for the families, help them prepare for CFTMs. Our goal is to support the frontline service professionals as they support the families they serve. We do a lot of this by participating in community network meetings. We participate in community advisory boards, community meetings, court collaborations to learn more about the resources available in each region. We also provide relevant training to DCS, court, and community providers about prevention services. We also coordinate with the FFPSA implementation team to collect and analyze data on prevention program effectiveness. Long-term family-level outcomes are to reduce the risk of child maltreatment and foster care placement, improve child well-being and development, increase family resilience and self-sufficiency. Long-term system-level outcomes is to enhance the capacity of prevention within each region. We are working to foster relationships and partnerships between DCS, service providers, and the community as a whole. There are 12 regional prevention consultants across the state of Tennessee. I'm going to leave this slide up here for just a moment so you can see who your prevention consultant is, along with their contact information. We encourage you to reach out with any questions that you might have any discussions or problem solving, any CFTM preparations, or case-related discussions. These can take place over the phone, via text, email, or virtual or in person. Please reach out and let us know how we can help support you. The successful implementation of the Tennessee FFPSA Prevention Consultant Project will contribute to a shift in the child welfare system, prioritizing prevention efforts and building family resilience to ultimately achieve better outcomes for children and families in Tennessee. I'd like to thank you for your time and your attention. We hope this training has been informative. I encourage you to scan the QR code on your screen to access our webpage. And again, please feel free to reach out to us at any time.